Okay, we're counting down and we've started recording this. And I'm going to come over and fix my deal on slideshow, and now I have to come up and mark the little felt pen. Okay, this is the beginning of the recording. So I'm Dr. Bill Wyatt, and I'm going to cover a method of bringing in impacted teeth. I came up with this way of doing this back in about 1985, something like that. And it was just out of necessity that I just happened to learn how to do this, and so I'll try to pass it on to you. But it is, my way of thinking, the most effective way to bring impacted teeth in the mouth that I've ever seen. So I'm going to cover the mechanic part first, and I'll show you the first case that we ever did with this. I'll probably duplicate a lot of this, and I may tell you something 2 or 3 times in doing this. But I'm going to try to cover the slides as we go along with them. Now, this is a closed coil spring, which I'll talk about further, and we've tied it back to the back of the molar tooth, and you bring it back in, and usually this spring would be about this long right here, and we turn down one end of it, and we tie dental floss in it. Then you run the dental floss back up here and kind of double it and go back and hook it onto your tooth, and then you come back out and you have one side of the string over there, the dental floss, and the other side would be over here. As we tie the knot, you see we tie it out here, and we tie this, it'll stretch that string on out, and you can stretch it till it gets out to this circle we have on the arch wire. And that'll put whatever amount of pressure there, and then this wax dental floss is going through there and hooks to the hook you've got on the tooth. This hook would probably have to be something up and around in this area, and you hook it, and it pulls this tooth down with whatever force, and the dental floss has very little resistance sliding around this 90-degree corner. I measure the spring's tension to see how much. I'm going to take a Dontrix gauge and do that, and I'll show these pictures in a minute. So we've got this other spring in here. It's an open coil spring, and that is condensed into this gap so that it is pushing both the lateral and the bicuspid apart, and then we're trying to bring the cuspid down into this spot, and we make this little loop in the arch wire right at the spot where we want the tooth to go to. Now, I'm going to elaborate on this some more as we go, and I'm going to erase that. We'll go to the next slide. Now, this, let me say, this side is for pulling in teeth that are on the labial or outside the buccal area. You can go up like that, and we show this side as you bringing in a tooth from the lingual aspect. Same thing. You've tied this spring back here and pulled it over. You've got it tension going up and goes to the hook, comes down, it pulls it into the mouth from the lingual side. The same spring opening the gap here as you bring the tooth down. I'll say you may wonder what this is right here. This is a rotating chain. We half hitch it on here and bring it around and tie it to the put it over the bracket, but we don't go over the arch wire, and it'll rotate this tooth in this direction. Now here you look at it from the lingual side, so you can see the palatal impaction and pulling down one from the labial, same thing. And you build an arch wire. If you got two of them in a case, you build this arch wire coming around like this, come on around on this side, then you do the same little deal over here. That makes that deal when I come around, makes that little sign come up. And fixing your loop and your wire, I like to make my own loops, hooks, whatever you want to call it, and we put them on lingual buttons, or we may put them on brackets, like this one in here is on a bracket, a small bracket. And here's the type of wire that we use, and we still like to use this high T spring like this. This is the size of the wire is 010, and the size of the lumen of the spring is 036, and this is closed coil spring, and this is high T coil spring. Now you could probably do this with the newer springs that, the nitinol or things like that, but this works perfectly well. So I'm used to using it, and I would recommend that type of spring. Now we cut off a piece of that spring about around a half inch, or maybe depending on how far you're gonna drag it and everything. Stick the end of a gerback plier in it. You've got about 2 or 3 rungs of the spring, you see right in here, and then I'm going to bend those out to the side. So now it's going to be kind of like that, and you can hook on to that, run your dental floss through it, or run the tie back wires you put on the other end. And we bend that down, this spring will be bent out like that. That'll be sticking out the end of it. Okay, we've done that to the spring. We have both ends like that. Now we take a piece of 012 soft ligature wire and run it through this loop in the spring. Now I'm just going to tie a knot in that wire. The other end we run dental floss through it and be sticking way on out there on the side. Now we take this wire, this 012 wire that I talked about here, 012, it's 12,000, and tie a knot in it. Just pull it down and tie it so it'll stay right there. Now we're going to hook this over the molar bracket if that's where you're pulling from, and we've got the dental floss in the other end. Alright, we've hooked it over a molar back here and tied it and twisted it down back there, and now your wire comes up. I've already stretched this some. It was about here, and we may stretch it out to this point to go in to put our floss on there. I hope I can explain this where you can go home and do this now. Alright, this slide probably should have been in front of the other. this is the distal now, and I reach back there with the spring. This would just be out in the back of the mouth or folded up in here somewhere, and tie it to the molar bracket back here. Twist it down and cut this off and tuck it in where it won't bother. Now we're going to bring this spring. You can bring it around over this, or you can just bring it straight across like that. Doesn't matter, just get some. We're going to stretch it out. Now here's a Dontrix gauge. If you're not used to this, this is just like measuring a fish scale or something. On this side, you push it in and you can tell how much force you're pushing out with it. Over on this side, I couldn't get it in this picture, you've got a little hook over on the other side, comes out. This is there'll be a little hook over here, and you pull this thing out. As you pull it out, you measure the amount of force that's going in it. Maybe we'll have a different picture. Okay, here's the side that you're going to push with, and it goes up to 16 ounces, or it's a whole pound now. If you push and this goes in this far, that's 1 ounce. Here'd be 2, 3, and then these double lines are 4. And up here would be 8 ounces, and this would be 12 ounces, and this is 16 ounces. So if you push this all the way into the shaft and you're up to this point, you'll be pushing out with 16 ounces of force. Will be pushing. So you can measure different things, and we just consider 1 ounce. 1 ounce was equal to about 30 grams, and if that's the way you want to measure it in grams or ounces, whatever, it doesn't make any difference. You just you got to put enough force on it to do the job. Now let me see if we show the other end. Yeah, here's the other end of it, and you don't see any rings right here, but when you pull this out, you'll start seeing those. And if you pull it all the way out, it'll go up to about a pound, or a pound of force. So here we've hooked onto our spring, and we pull this out, and if I remember correctly, that went all the way out. See, that's like, there's 4, 8, 12. But it seemed like I pulled this spring when I stretched it about that far. It had 16 ounces of force on it. Now here's your dental floss. You're going to take that and you double one side of it, just double it like that, and shove it through this hole, go up and hook it. So now we've got the dental floss coming out of there and coming from here. And the spring would be back in here. And if we tie a knot in it, it'll stretch the spring out to this point, right where it goes up in underneath there. Alright, we relax the spring, and this back, there's no force on it. It's a closed coil spring. And we can activate it up to this point right here. That's as far as you can stretch this thing. And then double your floss, go through here, and the floss is coming out. So rather than stick it through and hook it and put it back through, we just double it, stick it through and hook it. We've got one piece of the floss here, and then the other piece would come over here, and we tie a knot in it and pull on that to tighten that knot up, and this wax floss, it'll just slide, and then it'll stretch that spring out to that point. And you've measured how much, if you want so many ounces, you pull this out to a certain point here, you see. And if you want as much as you can get with it, you pull it so it gets right to that point there. Now, This is rigged up in two different ways you can pull with this when you use this spring method. I can pull the spring in, and it's pulling here with about a pound of force on this tooth, bringing it down. Now it really brings this tooth in. Now we've got this little open coil spring that we squeeze in this space that's opening this gap. If you need the gap opened, or if you've got just what you want, you still have to put a spring in here, or you start pulling with this, then it'll pull these teeth up and close your gap to a certain extent. So you need this in there as a space maintainer or a space gainer, whichever one you want to call it. Now there's 2 or 3 subtle things about pulling it in from the same arch that most people don't think about or don't realize. That this force right here, you stretch it out, you got a pound. It's putting a pound force on the maxilla, bringing the whole maxilla forward. It's working off of these teeth back here, but it's pushing this part of the maxilla, or you're going to get expansion in the maxilla by bringing these teeth out and doing that. So this pulls forward with it at a pound of force. If you got a pound on the other side, you've got 2 pounds of force bringing the maxilla out like that. It's kind of picking up yourself with your bootstraps, but that's what's happening. It's pulling on this, and it's playing against this cuspid tooth. It's pulling it down while the maxilla is coming forward. Now if you pull from this side and run this under, then the patient has to hook this one. This has to be an elastic, and the patient has to hook it. Now that pulls the lower arch forward as you're pulling this tooth down. It may be hard for some people to see that, but as you're pulling on this, it's pulling this upper tooth into the mouth. It's also picking up these teeth because they're tied onto the arch wire, and it's pulling with whatever force the elastic has. It has a forward motion on this. So if you had a class 3 case, you sure wouldn't want to use this method and impaction in it. You had a class 3 case, you would definitely want to use this because it helps bring the maxilla forward, correct, in your class 3. Now if you got a class 2 case, it's good to come down below and pull this because you're pulling the lower arch forward while you're connecting or bringing the tooth into the mouth. So that's a little subtle trick of this also. Now if you want to know how much the elastic pulls, you stretch it out and also kind of estimate this distance and put it out to here. See, this is gonna have to be the same length in here. So this is pulled. Can't see exactly, but I'm sure it has, say, 14 ounces of force pulling it out in that direction. So it's possible to put the dental floss on here and hook it, and then also come up with an elastic. That way you'd pull this arch forward and this arch forward too, depending on whether it's class 2 or class 3 or class 1 or however, which one you want to use. Now, pulling from the inside of the mouth, we can pull with this elastic also if you've got these hooks. Now you send these cases off to the oral surgeon to uncover and put a hook on. He'll always send back a chain, he'll send these one little gold chains that's attached to the tooth. You have those little, and so you've got to thread the dental floss through a loop of the chain. But the good thing about it is the tooth comes into the mouth. You just move your dental floss up to the next notch in the chain, and you can pull the tooth down where you want it with the chain. But you can't hook an elastic to the chain. It'd be very difficult to go in there and put a hook on that chain. So I prefer the hooks that we make up for that. Now, here is this rigged up with both pulling from that's on the buccal side. And now we'll try to explain the dental floss a little better now. So here your spring's all hooked up. You run the dental floss through here and you've got two ends on it coming out. We take this one end and kind of double it back like such. Now we run this part through here and hook it up to the molar tooth and pull these legs together, and you tie a knot in this. See, so here I've folded this floss back and stuck it through, and now I'm going to go up and hook it to that hook up there. So you've got a double layer of floss here. We'll catch that with something and reach up there, a little pair of tweezers or something, and drop that over that. So now the floss will come up and come down and come out like such. Now we tie that and pull it up tight, and so it stretches the string up to that point, or stretches the spring, I should say. Alright, let me go back now. I've got these slides out of not too good a order, but here we've got the dental floss now running in, and it was doubled and went up here and came over and came back out. And now we have the other deal. Now we tie a loop in this to make your knot, and we start tying this knot together, and it'll start pulling this up toward this point right here, and then you run in through there. So the tooth now is going to, there's another thing here you need to do. If you want to pull the tooth at an angle, you can run a triangular rubber band in there like that, and that'll pull the tooth in kind of this direction. The floss now is going to pull it straight down here. As we start opening up a gap for a tooth like this, you're pushing on the crown here, and the root of the tooth of this, say, bicuspid is back up here. As you push the crown this direction, the root will tend to move in that direction. And if you push the lateral up here, that root will tend to move to kind of close this space up. So to prevent that from happening, that is, if your roots of the lateral and the bicuspid are close together up here, then you can put tip into this tooth. I think I showed that. Let me go back here now. Okay, so you can put some tip in your arch wire. In other words, you want to keep the height of the tooth the same in here, so you're going to try to tip this back, so something like this. Now you have to flex this arch wire and engage it into this deal, and instead of the root going off like that, it's going to come off like this. So you put tip in this. So you bring the arch wire over, you make a little bend here, run it up this way, and now bend it back, and so it over like that. Now that's putting tip in it. You'd want to put the reverse of that on the other side. Excuse me. That's not the way. See if I can erase that. Okay. You'd want this tip to come up and run across the lateral and come back to your arch bar that way. These are things people don't think about a lot of times. Now as we tighten that string up, we pull that thing all the way up like that. And that's some more drawings on that. Alright, there's the dental floss folded back and hooked onto the wire and the two ends. Now this end right here goes over and hooks to the spring, and this one would too, see. As we pull on that, or tie that knot and pull that spring up. Now there it is, laying out. So there's the dental floss is like this, and this part of it goes over here and goes in, comes back around your hook, comes back out, goes over here, and now you tie a knot at that point. And you start tightening it up, and it'll slide through the wax floss, and it'll pull this thing right up to that point. So there we're pulling on the knot. You pull, and I make about 3 loops in there, so that'll kind of hold when I get it up there. Put your finger on it and put the other, tie it really good so you don't want it coming untied during the time the patient's wearing this. Now we pull it up here, and we put another knot in it and another knot, and we cut it off. And now this is pulling with the full force of this spring, and there'll be very little friction in that waxed floss, so you'll have almost the exact force that you've got here that's going to be pulling this tooth down and out through here. Now you may bump this tooth here, so you might want to put tip in this wire so that you get this root moving over in this direction, so you get that tooth by the space there. You can just do almost anything you want to if you just think it out and put it on there. It works out. Now here it is again, and as you pull it, as this tooth moves out here now, then this spring's going to move back, and you might come in, the spring will be back over here. But it'll have almost the same force a month later, or sometime you want to see them maybe every 2 weeks, every 3 weeks, something like that, till you get some of this under your belt, and you won't be worrying about it, but it'll pull that tooth right on into place like this. Okay. A lot of this is duplicated pictures, but maybe you need to see a bunch of it to get it down. So this is the dental floss pulling on that. I've got an elastic pulling on it too, so you can use brackets and bring the elastic up like that on them. So this is just another example of it. Same thing coming across here. Now those hooks that we use on these brackets, I didn't explain that each of these brackets has a little vertical slot in it, and you take one of these little T-hooks like this, they're built out of real soft metal, and shove them through that vertical slot. Then you just bend the end of that over to keep it in place. Now you can hook elastics on those little loops if you want to, or just use them for all sorts of things. So the vertical slot in this is handy thing to have. So this is, we got them from TP Laboratories, and they come, this is just a piece of wax and it'll deal with all these little pins stuck in there. And we use those quite a bit. They're built out of real soft metal. Now that's, I'm going to pause now on this case and go to the first case that I ever did with this. So, alright, we're started up again. I not I can't go to this first case with this program, so I'm gonna just pick up and show you a whole bunch of cases using this. Now we've gone about 30 minutes with this already. So this case right here is a young lady that worked in our office. What happens here? I'm gonna have to pause again here, looks like.